Hello everyone, welcome back to my YouTube channel. My name is Samantha Taviramo, a nurse, and on my channel I share everything nursing, health, lifestyle and vlogs. And if that is the content that you're into, feel free to subscribe, like the videos, share them to whoever who may need the information, and do not forget to hit that notification bell so you don't miss out on any of the videos that I post. We are diving into another reproductive health topic, which is ovulation. So we want to understand what is ovulation, what are the signs of ovulation, what are some of the factors that contribute to no ovulation or an ovulation, what are the signs of no ovulation, and basically what to do if you're having this problem. So without further ado, let us dive into the topic. Ovulation is a crucial part of the menstrual cycle, where the mature egg is released by one of the ovaries, making it available for fertilization by the sperm. Ovulation is controlled by a complex of hormones, and it usually happens about 10 to 16 days before the start of the next menstrual period. So I already talked about this in the menstrual cycle in my previous video, and I talked about the 4 phases, that is the menstruation, the follicular phase, the ovulation and the luteal phase. In my previous video I talked in depth about this, so if you're interested in knowing this or learning this, I think you can watch my previous video. I also went over the hormones, the follicle stimulating hormone, the luteinizing hormone, the estrogen, the progesterone. So if you want to know more about that, do check out my previous video. Recognizing signs of ovulation can help women understand their fertility window, especially those who are trying to conceive or those who are trying to avoid pregnancy. And another thing you have to note is signs of ovulation vary from woman to woman, or lady to lady, or girl to girl. Some women may experience multiple signs, while some may experience minimal to no signs. Our first sign is changes in the cervical mucus. Cervical mucus is a fluid produced by the cervix, and this changes throughout your menstrual cycle. Around the time of ovulation, the mucus becomes clearer, stretchy and slippery. It starts looking like the raw egg white, and these characteristics of the mucus actually help the sperm to swim more easily through the cervix to the uterus, increasing the chances of fertilization. The rising levels of estrogen are the one responsible for causing the cervix to produce this fertile mucus. So you can check with your fingers. It doesn't break. If you're checking with your fingers, it normally doesn't break. It is slippery, it is stretchy, it doesn't break. And also what you have to know is the more stretchy it is, the more slippery it is, the closer you are to ovulation. Then we have the basal body temperature changes. This is temperature at rest. So before ovulation, the basal body temperature is around 36.1 to 36.4 degrees. But after ovulation, this temperature slightly increases by 0.3 degrees. And this is normally due to the increased progesterone levels. What you have to note that this temperature is taken first thing in the morning before you leave bed by using a special basal thermometer. And temperature is one of the commonest symptom or sign that most girls use. I've had girls use the symptom a lot, but that is the reason why I'm giving you more signs, more symptoms, so that you can have more knowledge about this. Ovulation pain. You've had people complain about lower abdominal pain during a specific period every single month. This happens normally during ovulation, and the pain can be mild to moderate, and it normally happens from a few minutes to a few hours. So another thing you have to note here is typically at the side of the abdomen where the ovary is releasing the egg that cycle. So it can be on the left, it can be on the right, depending on which ovary is releasing the egg that cycle. And this pain can be a dull ache or a sharp pain accompanied by other signs of ovulation. We also have breast tenderness and sensitivity. This is another common sign of ovulation, and hormonal fluctuations during ovulations normally cause sensitivity, soreness and tenderness in the breasts. This occurs normally in one breast or both breasts. So you may experience a discomfort or a notable pain. Another thing you have to note about breast tenderness being related to ovulation is that the tenderness occurs in days immediately following ovulation, which is similar to the tenderness we experience before menstruation. So are you getting something here? That is the reason why I always tell people that monitor or track your menstrual cycle so that you can know exactly when your menstruation is coming and when exactly you are ovulating. There is also increased libido. So some women will experience increased sexual drive during their fertility window, and this is in alignment with ovulation. So here the body will be telling you, I'm ready, do something, I am ready. This natural increase in libido during this time of the month also varies. So it may be a weak sign or a strong sign in varying individuals. It is not because I have mentioned it here, I have said it is a sign of ovulation that you're going to experience it. You may experience it, you may not experience it. There are also changes in the cervix position and firmness. The cervix undergoes notable changes during ovulation. So it becomes higher, softer, and more open to allow the sperm easily enter the uterus. So this is caused by the increasing levels of estrogen, and you can check the position and firmness of your cervix by inserting a clean finger down there. So during ovulation, you will notice that your cervix is more softer, is more open, and is more higher compared to the rest of your time. When you feel it, you'll notice that the cervix is more firm, like the tip of your nose, and also it is lower. There is also heightened sense of smell. Some women have reported increased sensitivity to odors during ovulation. Now, this is also another sign of ovulation that not every woman experiences, but some women do. So if you notice that the smell is stronger and more intense during the middle of your cycle than usual, then this could be a sign of ovulation. Slight spotting or light bleeding. A small percentage of women normally notice this during ovulation, and they normally mistake it as a period. And if you've been having unprotected sex, this could be an early sign of pregnancy, normally called implantation bleeding. This is usually very light and appears to be pink or a brownish discharge. One thing you also have to note is spotting during ovulation occurs due to the rupture of the follicle when the egg is released, or as a result of hormonal fluctuation and changes. And ovulation spotting is typically very light, occurs in the middle of your menstrual cycle, and lasts a day or two. So the last sign of ovulation that I have for you is bloating. Women will experience fullness during ovulation, and this is often due to fluid retention and hormonal changes. So we have finished discussing signs of ovulation. We go to the factors that contribute to no ovulation or anovulation. Anovulation is when ovulation does not occur or the egg is not released from the ovary. These factors can range from hormonal imbalances to lifestyle choices. So let us discuss some of the factors. Hormonal imbalance. This is the most common cause of anovulation. So hormones like luteinizing hormone, follicle stimulating hormone, estrogen, progesterone all have to be in proper balance for ovulation to take place or to occur. If any of these hormones are too high or too low, they will disrupt the ovulation process and it will not occur. Polycystic ovary syndrome. This is a common endocrine disorder affecting up to 10% of women of reproductive age. It is also a leading cause of infertility and anovulation. So polycystic ovary syndrome is characterized by androgens. These are also male hormones and insulin resistance, which disrupts the hormonal balance during ovulation. And I already talked about hormonal imbalance up there. If the hormones are disrupted in any way, ovulation will not take place. So what you have to know with the polycystic ovary syndrome, it normally affects the ovaries. So multiple cysts normally grow onto the ovaries, interfering with their maturity, function, and release of eggs. Age and perimenopause. So naturally, as women age and grow, their ovarian reserve or the number of visible eggs in the ovaries naturally declines. During perimenopause, the hormonal levels are fluctuating and the menses are becoming irregular. And another thing is that the ovaries will not release an egg every single cycle, leading to more frequent events of anovulation. Another factor is drugs, especially women who are on chemotherapy drugs. Chemotherapy drugs cause temporary or permanent anovulation. So mainly women who are cancer patients normally do not ovulate. So you have to keep this in mind. There's also family planning pills. Combine oral contraceptive methods or pills. They work by preventing ovulation as part of their mechanism. It's like a side effect, an undesired side effect. So you will notice that women who have been on family planning for a very long time normally have problems when they have left them or they are on them. They may normally have difficulty ovulating. Another point is intense exercises or intensive exercises. Intensive exercises combined with low body weight normally lead to a decrease in estrogen production. And we already know that a reduction in estrogen disrupts the menstrual cycle, so the ovaries will not be able to release the egg for fertilization. So, exercises. Have you been watching the Olympics? Have you seen have you seen the ladies doing gymnastics? Have you seen the ladies that run? I don't mean this running long distance. I mean this running. Is it 100? I'm not a sports person. I don't know these things. But if you're looking at if you look at the women who have done Olympics, especially those ones in gymnastics, especially those ones who have done short distance running, that intensive exercise, women who are hitting the gym so hard, those intensive exercises are the ones that I'm talking about, and combine it with the low weight, it is going to cause issues. So if you're doing excessive exercises and you're not taking care of your health, you're going to cause a drop in the estrogen. And when you cause a drop in the estrogen, you're going to bring about problems in your menstrual cycle. And when you bring about a problem in your menstrual cycle, the ovary is not going to be able to release the egg for fertilization. And when that happens and you're trying to look for a child, you're going to have issues. So generally, just take care of your health. That is all. Other factors too, like the primary ovarian insufficiency or the premature ovarian failure. Then we also have thyroid disorders like hyperthyroidism and hypothyroidism. If you're too thin, if you're if you're too thin, you're not going to be able to ovulate. So look into your health too. Then also obesity. I do not know what's happening in the world right now. Yes, they talk about but but you also have to look at the health side. You may talk about body positivity when you're suffering from diabetes, you're suffering from hypertension, you're suffering from all medical conditions, and you're going to die young. So talk about body positivity when you are talking about the health body positivity. So if you have obesity, there are going to be difficulties for you to ovulate. Try hitting the gym. Look into what you're eating. Start small. I do not encourage this intensive thing of I'm going to lose how many kilograms. No, start small. We all start small wherever we are, and we keep on gaining. So start small. Those are some of the factors that I had for you that contribute to an ovulation or a person not ovulating. So now let us discuss what you can do when you're faced with this problem. If you realize or sense in any way that you're not ovulating regularly, the first thing is you have to address this issue. Here are some of the steps that I took out for you. Number one is recognize the signs of an ovulation or recognize signs of a person who is not ovulating, because this is going to help you to realize if you're ovulating or not. So let me discuss for you roughly the signs of a woman who is not ovulating or who has a condition called an ovulation. So number one is irregular or absent periods. So what you have to know is ovulation regulates menstrual cycle. So without it, periods can become irregular or absent. They may not occur at all. So if you're experiencing any irregularities in your periods, you may not be ovulating. Then there is abnormal menstrual flow. When ovulation does not occur, the uterine lining may not develop properly or shed off properly. So you will notice light or heavy bleeding. I already talked about the basal body temperature. There will not be a rise in the basal body temperature. If you're not ovulating, there will also be lack of cervical mucus changes. The mucus is not going to be clear or stretchy at all. And this woman will also have difficulty in becoming pregnant or conceiving. This is a very common sign of an ovulation. Then also another sign that these people will always notice is persistent agony and excessive hair growth. Remember, I can give you an example of a woman who is suffering from polycystic ovary syndrome because it's characterized by androgens. Those are the male hormones and insulin resistance. If the high levels of androgen in the woman's system, she will notice that she will have increased hair growth on her body. If you have this excessively, it could be a sign of an ovulation. Then of course, hormonal imbalance symptoms, for example, mood swings, fatigue, weight gain. So if you have any issues with hormonal imbalance, please treat this as soon as possible. Then the last point I can talk about is no breast tenderness. If a woman month in month out does not experience breast tenderness, this could be a sign that you're not ovulating. So once in a while, go for these checkups and find out what exactly is happening. And addition to this, you will not also experience any signs of ovulation. So track your menstrual cycle for medical information when you go to the hospital. Because when you go to the hospital, the healthcare provider or the gynecologist is going to ask you questions. So you should be able to tell him or her what exactly is happening in your body, what you have seen, what you've experienced. This helps the healthcare provider to quickly find a solution for whatever is happening to you. So consult a healthcare provider if you've been tracking your menstrual cycle and you notice any irregularities and you've been trying to conceive for over a year without success. I think it is time for you to book that appointment and go see your gynecologist or healthcare provider immediately. Then there will also be tests done. Hormonal blood tests will be done. Any hormones that regulate or affect ovulation will have to be tested. So for example, the follicle stimulating hormone, luteinizing hormone, estrogen, progesterone, prolactin, thyroid hormones, all will have to be tested to check if these hormones are well balanced out or they are too low or too high, so that they can help you out. Then of course, an ultrasound will also be done. It helps to provide better assessment of the ovaries and the uterus. We look at the ovaries. Do they have cysts on them? And also the uterine lining, its thickness. Another point is identify and address the underlying causes. For example, if you're stressed out, find relaxing activities. Do some yoga, do some walking, some evening walks, like find things that actually relax you. Another thing is have enough rest. Rest is very, very important. Sleep is important. So have enough rest. Achieve a healthy weight. I'm talking to people here who have issues with weight. If you have low body weight, if you have obesity issues, try achieving these. Baby steps are very, very important. If you want to get healthy, you will take steps to getting healthy. If you don't want to get healthy, no one is going to force you. So it is all up to you. Then adjust your exercise habits. People who are doing intensive exercises, this leads to a decline in the estrogen production. So you have to look at the balance between the two when you're doing exercises and also the health habits, so that it does not affect you in any way. If you also have hormonal issues, I'm talking about people who are suffering from hormonal imbalance, please have this checked out and have it treated as soon as possible. Hormonal imbalance is one of the commonest problems in women, and we need to talk about this. We need to create awareness about this so that more women can get to know about it and have it treated. The last point is monitor your progress. Yes, you've gone to the hospital, blood tests have been done, you're on treatment, maybe you're improving. Monitor your progress. Go back for regular checkups. Some people, when they feel better, they don't go back to the hospital. Go for regular checkups. Find out if your hormones are now intact. Find out if they are now too low, they are too high. Like, go for regular checkups. When things have gone back to normal, do not ignore to go back to the hospital for regular checkups. Another thing is you have to stay patient and very, very positive. Treating an ovulation or treating these signs, it takes a lot of time. You're not going to become fine just like that. No, things do not happen like that. They take time. So another thing is, I would really, really appreciate it if healthcare providers, when they are treating these people, if maybe a gynecologist is treating this person, they can have like an open discussion. Like, be open, tell them where you stand, exactly what they need, instead of lying to the patient or giving them false hope. Sometimes it is better to be upfront and tell the person exactly what is happening. Lastly, don't forget to pray. It takes a lot of time. You have to be patient, you have to be positive, but you also have to pray. Remember to pray. Miracles still happen. God still listens. Whoever you pray to, remember to pray. Spiritual journey will help you a lot. It will give you immense peace and calm during this storm. So do not forget to pray. Thank you for watching this video. If you found it informative, do not forget to give it a thumbs up and share the video with anyone who may benefit from this information. If you have not yet subscribed to the channel, join the family already, and I'll see you in my next God bless you all and stay blessed.